What is the first thing you should do when you enter a speech block? First, remember what a speech block is. It's a kind of resistance when you yourself are pressing your own jaw with your muscles, with your body. Usually before this happens, your breath gets stuck and you can't breathe. Or your breath leaves you very slowly because you feel fear, some kind of tension, and you start to freeze up. So what then? What is the first thing you need to do in order to further increase your chances of saying a word normally? For example, imagine a situation where you're all bent over like this, twisted up, and you need to run or maybe jump or throw something into a basket or a box. What's the first thing you need to do it properly? To perform a normal, adequate, straightforward action? Straighten up. That is, straighten up from a bent position. So, what should you do first when you've already entered a speech block and started tensing up, putting pressure on your own speech muscles, trying to force out at least a word, or even just a difficult sound? You need to shift into neutral. You need to relax. You need to sort of straighten out your muscles if you notice that some of your muscles are tense or crooked or your tongue is pressed somewhere. Your speech apparatus is tense or something else. Your jaw is clenched, tightly shut. The first thing you need to do is straighten up, because otherwise nothing will work. It's impossible to perform a normal, adequate, good action if your speech apparatus is in the wrong position. These seem like simple things, but when we stutter, we don't think about them. We've already started to tense up, and then we wonder, what should we do? And we try to get out of this crooked position as if it's some kind of rut. It won't work. In other words, either you start from a normal state or you start from an abnormal state, and in any case, with this approach, you'll get an abnormal result. That's a 100% guarantee. So you need to remember, in order for a word to come out fully and properly, you need to start properly. That is, your speech apparatus should not be overly tense, so that your breathing doesn't get stuck, doesn't freeze up, so that your throat isn't tense, so you don't feel like there's a stone in there and nothing is coming out. What exactly to do about this, we already cover in the training program, but the most important thing right now is to understand what, in principle, can be done to start off properly.